Hello everyone, I am Dr. Deepti Thakkar, General and Bariatric Surgeon at Live Life Hospitals, Hyderabad. Today we are talking about obesity and bariatric surgery. We all know that obesity is increasing all over the world and in India also. So what is obesity? Obesity is basically excess accumulation of fat in our body which slowly starts affecting the different organs of our body. So how can we measure obesity? A simple technique called as body mass index or BMI. BMI is calculated as weight in kilograms divided by height in meters squared. If you don't want to remember this, you can just go to any app online and check it. If the body mass index is more than 30, is when a person is considered as moderately obese. When the BMI increase is more than 35, it is considered as severe obesity. And when it goes above 40, that is when we call it as morbid obesity. At this stage, the weight is definitely affecting the different organs of your body. Interestingly, in the Asian and Indian population, we actually consider obesity levels a little lower than the Western population because Asians tend to have more of tummy fat or visceral fat. This directly affects your heart and diabetes. That is why in the Asian or Indian population, a BMI more than 32 is considered as severely obese and more than 37 is considered as morbidly obese. So what are the different reasons for obesity? Of course, we all know that we are all turning to easily available junk food, processed food, ready to eat foodstuffs, and we want to enjoy our weekends by indulging in different types of restaurant food. This is of course the first and foremost cause, but there are also other causes. A sedentary lifestyle where we don't work out or exercise as much as we should. A more of a seated lifestyle where we keep sitting for hours at a stretch. There are of course other causes such as genetic causes. If your family has a history of obesity, you will also be obese. There is a higher chance. Then there is hormonal problems such as thyroid problems. Hypothyroidism is a known cause of weight gain. There are certain medications which also cause weight gain, such as hormonal medications. Certain epilepsy medications, psychiatric medications also cause weight gain. Then there are certain hormonal factors such as PCOD in women, young girls, where they have an imbalance of their hormones which results in weight gain. So if any of these are a cause of your weight gain, if you are not indulging so much in junk food and being active and still if you are gaining weight, you need to see your doctor and find out what is the reason for your weight gain. So try to correct your weight first, earlier, before you reach the levels of severe or morbid obesity, where it becomes more and more difficult to reduce weight just by diets and exercise. What we have seen as doctors is that when the body mass index goes above 32, 35, it is difficult to lose weight just by diet and exercise. That is where we have to add or consider intervention in the form of bariatric surgery. Bariatric surgery is basically any surgery which is done to help a person reduce weight in a controlled and healthy manner, and so that they can maintain that weight for a very long time. So why and when do we consider bariatric surgery? Generally, we consider bariatric surgery for patients whose body mass index is above 40 or in patients with BMI above 35 but they also have obesity related problems. What are the obesity related problems? Type 2 diabetes, high blood pressure, high cholesterol levels, severe joint pains, back pain, severe sleep apnea or excessive snoring at night, which results in daytime snoring and sleepiness, and patients who we know could be at higher risk of future heart attacks or stroke. So these are the reasons where a surgeon will decide that with this body mass index and these associated other problems, this person would benefit much more from bariatric surgery rather than just trying and struggling with diets and exercise. So if you want to know more about weight loss, your BMI and what is the best weight loss option for you, you can contact me. I am available at Live Life Hospitals, Hyderabad. Thank you.